in terms of treating HIV/AIDS. Thank you so much, sir. You're watching World Insight. Coming up later in our program, no effort spared. China puts out all the stops to pour aid into struggling cities. Are these efforts paying off? Some answers after the break. Welcome back. You're still watching World Insight with me, Tian Wei. We're still dedicating our show today to the outbreak of coronavirus in China. We now turn to the Chinese government's efforts to contain the viral epidemic in the country, with confirmed cases approaching 60,000 on the Chinese mainland. Aid is also pouring in. As of Wednesday, tens of thousands of medics and hundreds of thousands of equipment have been sent to central China's Hubei province, ground zero regarded as of the epidemic center. More than 20,000 doctors and nurses and experts from all across China have gone to the hardest hit cities in Hubei province to support local containment efforts. On Thursday, Chairman of the Central Military Commission, Xi Jinping, approved 2,600 more medical personnel from the armed forces to be sent to Wuhan to treat confirmed cases, on top of ones that have already arrived. To ensure enough food supply for the communities under lockdown, central authorities have also earmarked 2,000 tons of frozen pork and also vegetables to be sent to Wuhan. That is a wrap-up of the latest efforts. And now I'm joined by two people in the know, shall we say. We have Professor Xue Lan, who is the Dean of Schwarzman College at Tsinghua University, and also joining us in Washington, D.C., Cheng Li, Director and Senior Fellow of the John Thornton China Center of the Brookings Institution. Gentlemen, welcome to our program. Thank you so much for joining us.
Thank you.
This is a critical time with a lot of efforts mobilized throughout the country, whether it's about medical help or others. Mr. Li, what do you make of the latest campaign to go against the coronavirus?
Well, before answering your question, I want to convey my empathy and goodwill for China. A country is in a very difficult time. Any person in the world recognize the painstaking effort by the Chinese government and the Chinese people to fight against the virus, recognizing the resilience, responsibility, and resolution on the part of China. So you have our great respect. Now, major steps have been taken, as you just mentioned, and I just want to emphasize a few things. One, actually, the change of local leadership, which took place a day ago. I think this is very, very important. Certainly, there's evidence of mismanagement, number of cases of the local government. And also, the public confidence of government is in stake. So I think that move is very, very important. Time for strong local leadership is now, and certainly Chinese central government made this very, very important move. But plus, what else you just mentioned, I hope that this will show the determination and also allocate the tremendous resources to fight the virus.
Well, having said that, though, Professor Xue, you are in China. You've been witnessing the outbreak and also the efforts against it. What do you make of the government official change for the past 24 hours, whether it is at provincial level, the provincial governor and also the party secretary of the province, Hubei, as well as those of local level at the city of Wuhan. Meanwhile, local CDCs of Wuhan have been changed as well. What do you make of these series of changes of personnel?
Well, I think this is a very timely and important decision. As Cheng has just said, that I think first of all, I think that we have to recognize the importance of both Hubei province and Wuhan in this fight with COVID-19. I think that, for example, if you count by the numbers, the number of Hubei's confirmed cases are about 80% of China's total number. And Wuhan's number is about 70% of Hubei's number. So I think those two places are really the critical, for the fight with this virus. So I think a really sort of strong and capable leadership is critical to win this battle. Secondly, I think, as Cheng has just said, I think that the leadership, I think the previous leadership has already shown their incapability in managing this crisis. And you can see that a lot of policies are just catching up. They're not able to be deployed and to be implemented in a very capable way. Mm. And the third, also, I think, as being said, I think that there were at the various sort of news conferences and so on that you can see that the leaders themselves are not up to the expectation of the general public. So I think the general public are quite somewhat demoralized by this incapable leadership, and so the change of leadership is very timely and critical.
Right. I want to ask another thing, Professor Xue, that is, now you see whether it's from the People's Liberation Army or from a local level across China, medical workers, the top-tier medical workers, have all been assembled and sent to Wuhan in order to manage the crisis there. But that would also mean that for the cities and provinces around China, there could be a thinner layer of medical support. So how do we see, well, the outbreak is still continuing, not just in Hubei, but also could be spreading to the other places of the country? Professor Xue.
Yeah, I think that's a very important question. I think that certainly, I think that given the kind of sheer number in Wuhan and Hubei, I think to mobilize the support, I think is very critical and necessary. But as you just said, that given that the doctors are poured into to Wuhan, and what about the rest of the places in China? I think first of all, I think you have to recognize China is a huge country, and with I think over the last 40 years development, I think China has already had a quite sizable of medical professions. For example, I think Chinese medical doctors, we are I think that by last account is over something like 3.6 million doctors nationwide, and the nurses are over 4 million nationwide. So I think what we're talking about, I think it's probably less than half of a percent being mobilized to Wuhan. So I think the concentrating in Wuhan, that's a large number. From the different localities may not be as many. I think that. So I think at the moment, I think different places can manage. But the critical thing is that we have to make sure there will not be similar outbreaks in other places. That's very critical. If we have a few more places like Wuhan and so on, that will put a much more stress in the system.
Another thing, Dr. Li, I want to go to you about is the extreme test of coordination this time as being reflected in the managing of the outbreak. Now, it's not just a public health care crisis. It is also about logistics. It's about manufacturing of the resources and supplies. It is also about international relations. So many things have been tested all at the same time. What about this stress test for China so far?
Well, you're right. This is the things never happened before to that scope and scale. And actually, Bill Gates 5 years ago warned us. He said that it's not that so much of a system failure would be any country, including the United States. There's no such a system at all to deal with this kind of quick spread of virus. So that requires coordination at the different levels for China. It's not only just the government, but also civil society, NGOs, but also requires international cooperation. Now, it is very, very important. People in China probably read some of the the editorials by Wall Street Journal is very nationalistic and xenophobic. But on the other hand, we should not forget that the International Committee is very supportive for China. There are a lot of other articles probably not well known for the leadership at the moment. Some will come out very soon. My friend Joshua Ramo, the Kissinger Institute, just wrote a piece. He talked about your earthquake is our earthquake. Your virus is our virus. It's really not China's problem, but the entire world should work together. So I think that it requires international collaboration, but also the change of the leadership, local leadership, appointed Ying Yong, Shanghai mayor, former Shanghai mayor, to that position, will also better coordinate. But also I noticed there's a policy in China to designate some provinces and cities connected with China, the Wuhan and the Hubei, some districts, some the county or prefects. These are all important moves for coordination. I think it's very, very important later on to learn lessons from a lack of system and in the global perspective. But for now, there's an emergency to stop the spread of virus. To a certain extent, that sometimes we should be the cautious side because the problem is not controlled yet. We still do not know much about that virus, as David Ho, also your early guest, mentioned. So I think it's very, very important to be on the cautious side, but also requires strong cooperation more than any time before within China and also beyond China.
Professor Xue, you're a public policy expert in China. You make your assessment of that point too.
Yeah, let me first of all, I think I fully agree with what Cheng has just made. And also, I would just want to add that, in dealing with crises like this, I think every time you will have some so-called a surge demand or the surge capacity problem. In this case, I think the demand is is for the medical doctors, for medical beds, and also for the supplies like masks and so on. I think that no country will be store that many as what's being required this time. So I think what Cheng has said is really critically important. So there's a need for when crisis happens, there's a need for local mobilization, but sometimes you have to mobilize internationally. So I think that in this case, I think China's most recently has adopted a so-called paired policy of different provinces, matching up with different municipalities in the Hubei province. So I think that's sort of an issue that I think we have to mobilize. I mean, we have to think about how we can actually establish such a system after we the fight is over.
Another thing is about what about from the medical perspective. Now, Professor Xue and Dr. Li, both of you know very well that China is trying to deal with the issue internationally through the help and support of the World Health Organization, WHO. How do you see the balance of, once again, of course, multilateral platforms such as the United Nations, on the other hand, the bilateral interactions to deal with the issue, and also different layers of the Chinese society for approaching other different layers are matching peers in other countries directly for the support? How do you see this overall map? Dr. Li.
Well, first of all, I want to say we should, as Americans, we should have a sense of humility. And most of the experts on this virus or pandemics actually outside China also tend to underestimate the scope and the scale of that challenge. And I think that also you probably heard that the U.S. CDC, actually the test materials also flawed. So this is not only just happening in China, but also from the international community. So I think this actually reminds us that we should really have more transparency in terms of communication and more coordination rather than just separate. I think that is the lesson we can learn. But of course, that people should not be panicked. And to a certain extent, that the mortality rate is still very low, and because of the recent increase, because of the different reporting system, certainly those affected number increased dramatically. But that's actually it's a right. First of all, honesty is the best policy. You do need to release all this data or this number. But in a way, it's quite scary. But I think people should not be panicked. I think that a lot of resources, we certainly know this time better than the SARS, and also there's more cooperation. And China is also much good position to fight it. I hope that with this kind of experience, this kind of things, that this time we will also come very strongly. But it takes time, and it's still not over yet. I think that the balanced view is most important.
It is very important. Seek truth from facts. Professor Xue, that seems to be critically important. Couldn't be more at this moment.
Yeah. Yeah. Yes, indeed. I think that I fully agree with what Cheng has just said. That first of all, I think there's a need, for transparency, not just in terms of research, but also for the general public to be able to deal with, to find their own way to, to mitigate the risk and to protect themselves. And also, I think the transparency can also allow the medical doctors and professionals and to learn more about the characteristics of the virus and also to find ways to treat them. And also, of course, I think for the researchers, I think the international collaboration is critically important. I think for this time, we see that I think the Chinese CDC researchers have released very early on of the genetic findings and then share that with the WHO. And allow the world medical professions to be able to do research on that. But I think, of course, how can we coordinate these efforts better? So I hope that after this episode is over, there could be a better way to coordinate globally in terms of the researchers and medical professions to be able to collectively to address serious challenges like this one.
We have learned that experience from SARS, something have been established, some mechanism as well, but whether we need to update them as a result of the latest tests, that is a question, certainly. We want to thank both of you for joining us for this very important discussion. Cheng Li from Washington, D.C., and Xue Lan in Beijing through Skype. Really appreciate it. Thank you so much, and be healthy, gentlemen. And that is all the time we have for today, for the live show today. If you'd like to see more, try to find us World Insight CGTN into your search engine, or check out our YouTube channel. Follow us on Twitter and Facebook as well. From me, Tian Wei, and everyone on the World Insight team, thanks for watching. Bye for now, and I'll see you tomorrow.